Institute of Diabetes and Digestive and Kidney Diseases has awarded a 5-year, $3.3 million grant to Scripps Whittier Diabetes Institute to study the integration of mental health services and the care of patients with type 1 diabetes to better address the emotional distress that often comes with the chronic disease. And here now to talk more about that is Dr. Addie Fortman. Dr. Fortman, thanks so much for joining us today.
Thank you for having me.
So this is a side that really nobody talks about. I mean, this is something that on top of already having a stressful situation with this chronic illness, but the mental health side of it is something that not a lot of people have probably ever even considered plays a huge factor in people's overall health. Step us through just what this grant is going to hope to address there.
Yes, thank you. So great question. Diabetes distress is not a psychological disorder, but rather a very real and understandable emotional strain of living with a lifelong chronic condition and managing that condition on a day-to-day basis. So because research has shown that, living with diabetes distress can have very unwanted adverse impact on someone's physical health, this grant will help us determine how best to support our patients who are suffering from diabetes distress so they can live that long and healthy life with diabetes.
And I'm sure this is something, too, that you have many personal stories of people that have either been diagnosed later in life or have been suffering this through their entire lives. I mean, what are some of the common things that you see? How is this directly impacting them?
Right. So I think I've heard countless times from our patients, I've received the best care, I've received the best attention for every aspect of my diabetes, except no one's asked me about the other side of my diabetes, the emotional toll it takes on me on a day in and day out basis. And the sources of diabetes distress can be multiple. There's many things someone living with a condition like diabetes has to do on a daily basis. So just the sense of overwhelm from the management tasks. Or perhaps it can be related to personal relationships. Sometimes loved ones have the best intentions to help their partner with diabetes, but if that support is not wanted that they're giving, it can often result in distress for the individual with diabetes.
And that's something, too, that I think is really poignant to say. These people who are probably closer to them than anybody in their lives, a spouse, a parent, that's really wanting to do the right thing and maybe just for no fault of their own is saying it wrong or not addressing something as significant as what they need. What will this money do? Where will it go? Will it invest in therapy with people being able to actually sit down and speak to somebody? What are those tangible steps that it's going to take?
Yes. So, this research is going to be very unique. Unlike a lot of studies, it's not going to take place in the laboratory. It's going to take place in the real world Scripps Clinic Division of Endocrinology. So patients, when they come into the clinic for their routine visits with their endocrinologists, will soon be asked a few questions. How are you coping with your diabetes? How are you feeling about your diabetes? And those who are distressed will have the opportunity to learn more about this study. If they enroll, the best part about it is patients in both groups receive an active form of support and intervention, either one-to-one diabetes education from a nurse or brief education followed by a group-based psychological treatment that's really honing in on their diabetes distress. Our goal is to come up with a model that can pull in the expertise of endocrinologists and psychologists and diabetes educators to really support the whole person with diabetes so that we can then share this model with other health systems so that even larger numbers of patients can benefit in the U.S.
And what a fantastic way to really look at something that, again, is just on one side of things, a very complicated, a very sensitive situation here because every diabetic comes with their own lives, their own problems, their own strengths. This is really saying, okay, well, regardless, we're going to look at all aspects of this and try to make this something that you can be your best mentally and physically, I would assume.
Yes, you're absolutely right. The main goal is helping patients get to a better and safer place with their diabetes from a physical perspective. And a lot of that requires addressing the emotional toll of living with the diabetes. And it's very hard to do that in a routine clinical encounter that lasts maybe 9 to 12 minutes. So we're hoping that this integrated approach will be just what our patients need.
Dr. Fortman, we are so excited about this. I hope we get to check back in with you. And even just 6 months, I'm sure that there's so much progress that's going to be made. I know this is a 5-year process, but I can only imagine what this is going to do for people. Thank you so much for joining us today. We appreciate it.
Absolutely. Thanks for having me.